San Diego's more local news station. This is the KUSI Morning News.
Forget the facelift. The cheek lift is apparently the new thing. And Dr. John Hilinski, plastic and reconstructive surgeon, joins us to talk about. It's called Endotyne, right?
That's correct.
Good morning.
That's
How are you?
Good morning. Great. Thank you for having me.
First, let's talk about the part of your face that you're focusing on.
Yes, the midface is commonly referred to as basically the cheek. And what we're talking about is the area that goes from this prominence here across the lower eyelid and below down to this fold, or the smile line, what we refer to as the nasolabial fold, which is that line that goes in between the corner of the mouth and the nose. This is kind of the midface.
Really? And so why is this different than a facelift? Does a facelift do the entire thing? Is that the difference?
No, it's actually a great question because I think the public has a misunderstanding of what a facelift actually does. A facelift truly is only lifting the lower 1/3 of the face and the upper portion of the neck, and really does nothing to the mid-face area, and certainly does nothing to the forehead. So when you talk about getting a facelift or having surgery done for aging changes, a facelift really will only take care of this lower part and not the mid portion.
What causes that look that none of us want, where it's pulled and there almost seems to be just sort of a pull right there in the middle of people's face?
Oftentimes that's the result of a facelift gone awry, and people who have facelift operation where they're either over aggressively pulled back or things were maybe done a little bit late and you had to really make an aggressive attempt at pulling things back for a more youthful look, then you end up with that kind of wind-blown or pulled look.
Right, like you're on a roller coaster or something. Let's show some before and after pictures. So we can give people an idea of what this looks like. What are we looking at here?
This is one of my patients. She's in her early 40s, and this is actually the general population or the target that we're looking at when we're talking about mid-face. These are people who begin to show signs of aging through that area I just described. So right below the lower eyelid as it goes down to the upper lip, and you can see on the left-hand side in her before photo that she's got kind of that shallow or hollowed-out look, where in the mid portion of her face she looks flat. And what that also does is it brings heaviness along that fold that I just mentioned, and then it also begins to bring unwanted attention to the lower eyelid where you see a little bit of excess puffiness. And you can see on the right-hand side, after we did a mid-face lift, we're basically pulling up those tissues. We're reversing the signs of aging, and it's done through this ingenious little device, which we'll talk about in just a few minutes here. But as you can see, she's got a real nice result, natural looking, doesn't look wind-blown or pulled.
Okay, how is it done?
So, as in most great inventions, it's very simplistic in terms of its concept. In years past, we used to have to lift the midface using sutures, which was very cumbersome, oftentimes left dimpling in the skin, and just left a very unnatural look. This is a great device that Endotyne, which is a company based up in Palo Alto, came up with. And basically, you can see these 5 prongs at the tip of it, about the size of a dime, and it's attached to this bioabsorbable leash. And what we do is we make a little incision up in the hairline here. Sometimes we have to make a second incision up underneath the lip, but oftentimes we can just do it in the hairline. And basically, if you don't mind if I demonstrate.
No, demonstrate away.
Is that
just put it in there while you're at it, actually.
We make a little tunnel, and we use a little, what we call an endoscope, which is a fine little telescope, and we just create a little tunnel up underneath the cheek, and so we kind of lift up this area of the face.
Right.
Then we
Which
insert.
would be really nice.
It's a really nice result. We insert this little device into the midface, and what these prongs do is much like a hanger. It just kind of grabs the tissue from underneath.
Interesting, and it just dissolves by itself.
And it does dissolve. It's bioabsorbable, which is one of the great things about this device. So unlike a cheek implant, which stays in your body forever, this is a material that dissolves over about 6 to 8 months. You really don't feel it when it's in place. And by the time it dissolves, your face is kind of resuspended and already readheres to where it should be, and you're left with that nice, youthful look.
Very interesting. I imagine less downtime and all of that
Much
as well.
less downtime.
Okay, great. Let's put some information up on the screen here. That is your web address and your phone number if you would like to get more information. And thank you so much, John. We appreciate your time this morning.
Thank you for having me.
Very interesting. Good job.
I think we make a couple of good guinea pigs right here.
I think that's what I said. Just throw it on in there. I'm here. You're here.
Right.
Let's just try it out.